Agape-In-Action was founded in 1998 by Dr. Street and Kathleen Street. His wife was an RN. They went down there on a medical mission trip soon after the Guatemalan Civil War had ended in 1996, and they saw the extreme need and the poverty, and they really felt called to go back down. Over the course of the next 5 years, they moved down there. They built a facility on the same grounds as the Santa Elena National Hospital, and they started bringing down teams from the Houston Med Center and all over the states. And they also started rotating medical clinics in the rural areas with American doctors as well as Guatemalan doctors and staff. Our main goal through Agape-In-Action is to meet spiritual needs through physical healing. We do this through our rural clinics. We currently have 21. We want to expand to double or triple that amount in the coming years to reach more people. At every single clinic, we preach a gospel message before the clinic. We have people on hand to pray with the people, to talk about Jesus, just to hear a prayer request, and to love on the people that no one has loved. Lastly, we want to raise up Guatemalan nationals to be leaders in the community and to be leaders with our clinics and at our facility. We want them to be able to be self-sufficient long after we are gone. Our overhead is covered by previously inquired investments. This allows 100% of all donations to go directly to the mission field and to the needy in Guatemala. Not one penny of your donation will go to cover administrative cost. We meet the needs of the people where they are through mobile clinics. 2 of our staff doctors are native Guatemalans who partner with local pastors to meet each community's specific needs. We are effective because we don't spend our funds on bricks and mortar, but on medicines and supplies that will directly help the people. Also, we meet our patients right where they live and work. We train Guatemalan nationals to be nurses and doctors and encourage them to lead the ministry. We want to support the locals to help their own people, and we do that by teaching them the skills they need. We identify potential leaders in each community and fund their education. We measure our success based on the number of patients being treated and the amount of clinics we have where more people can gain access to care. Every year since starting Agape-In-Action, we have increased our patient load by 20 to 30%, and we have done that because of generous donations that were used to purchase more medicines and pay for more staff. We have also increased the number of clinics we operate each year, which means we were able to help more people in remote areas where there is no access to medical care. We want those numbers to rise every year, and we know they can with increased support from our donors. A common misconception is that we operate a standalone hospital or clinic. We come alongside and assist the National Hospital to support them in whatever way we can. There are already structures there, and we want to use our funds and resources to support and train the locals. The Guatemalan people need medical care and assistance, but they do not need another building in Quiché. We want to focus our financial resources 100% on serving the medical needs and not on structures and maintenance. Not only have we continually increased our patient load year after year in our rural clinics, but we have continued to gain the respect and acknowledgement of our work from the Guatemalan National Hospital System. Without our help, the National Hospital in Quiché would not have been able to provide the level of care that they currently do. Agape-In-Action has worked to bring in hundreds of thousands of dollars worth of donated medical equipment to the hospital that serves a population of over 1 million people. Agape has also been identified by the Kimberly-Clark Corporation as one of the organizations in Guatemala that is making a sizable impact on child and maternal health. Our main challenge in Guatemala is changing the way people view their health and what they think of as healthy. For generations, the Mayans have lived off of tortillas, beans, and coffee. They cook in their homes, filling their house and lungs with smoke, and they regularly visit natural healers when they are sick or injured. Agape in Action aims to educate the minds through our clinics on modern medical and dental care. We believe that educating children will make the biggest impact on hygiene and healthy eating habits. We teach them by bringing volunteers to local schools. Because the current need for medical equipment is so great, only 4 out of 6 operating rooms are functional. With additional funding, we would send more medical supplies to outfit these needy hospitals. But even with fully equipped hospitals, there are many rural areas still cut off from modern medical care. The extra funds will allow us to expand our services to these remote areas and provide scholarships for nationals to attend nursing and medical school in hopes that they will return to serve their communities. Guatemala currently has the highest infant mortality rate in Central America. This is due to the distance to hospitals in emergency situations and lack of formal training for the village midwives. While we are providing basic life-saving techniques, many midwives do not have the proper birthing equipment needed to safely monitor and deliver healthy babies. With your help, we would be able to provide them with more in-depth training and equipment that would positively impact these unnecessary tragedies.